Hi, I'm Peter Glowitsky from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. The COVID-19 pandemic has affected the life of hundreds of thousands of patients and tens of thousands of healthcare professionals worldwide. As we go to the press today, on April 5, 2020, more than 1.2 million people tested positive for the virus and over 67,000 died worldwide. In the United States, more than 321,000 people have been affected and 9,132 died. The editorial of the June issue of the JVS highlights the role of vascular surgeons in this crisis. Doctors Rasmussen and Köhling from the Walter Reed National Military Medical Center provide their military perspective on the current pandemic and emphasize that the time to act is now. We all should use the SVS ACS guidelines as they were published online for the care of vascular patients during the COVID-19 pandemic. We must create capacity, implement policies, procedures to preserve staff, space, and stuff. We need to benefit from international partnerships and learn from others' experiences from all around the world. We need to operate in a resource-limited environment and optimize team performance and plan ahead of time. But first and foremost, protect your patients, protect yourself and your family from the COVID-19 virus. The June issue of the JVS has many great articles. Our CME article is entitled Population-Based Long-Term Outcomes of Open versus Endovascular Aortic Repair of Ruptured Abdominal Aortic Aneurysm by Conrad Salata and co-authors from Toronto, Canada, Riyadh, Saudi Arabia, and Boston, Massachusetts. This is a population-based, retrospective cohort study of all patients who underwent open or endovascular repair of a ruptured abdominal aortic aneurysm between 2003 and 2016 in Ontario, Canada. Results of 261 EVARs and 2,431 open repairs were compared, and a significant benefit was found in 30-day all-cause mortality in favor of EVAR. There were also significantly less major adverse cardiac events after EVAR, and the start-up benefit of higher survival after EVAR was significant until 4.5 years after intervention, but not at 5 years, and there was no difference in outcome at 5 years, and the difference between EVAR and OR was not significant at 10 years either. Our next highlighted article, titled Hemodynamic Events During Carotid Stenting Are Associated with Significant Periprocedural Stroke and Adverse Events, was written by Arthurides and co-authors from the University of South Florida. This VQI study included 13,698 carotid artery stenting procedures. Periprocedural hypertension resulted in a fourfold increase in immediate periprocedural stroke. Periprocedural hemodynamic events increased the risk of immediate periprocedural stroke and also the length of stay, myocardial infarction, and mortality. The study found prophylactic use of antibradyarrhythmic agents decreased the risk of periprocedural stroke in patients with symptomatic carotid artery disease. The next article I would like to introduce was written by Emanuel Tenorino, Gustavo Oderich, and colleagues from Mayo Clinic. It's entitled Prospective Non-Randomized Study to Evaluate Cone Beam Computed Tomography for Technical Assessment of Standard and Complex Endovascular Aortic Repair. This prospective single-center study evaluated the benefit of cone beam CT in 170 aortic intervention. The authors found positive findings in 25%. These included stent compression and kink, type 1 or 3 endoleak, dissection or thrombus. As an example, cone beam CT revealed compression of an SMA stent and then confirmed effective treatment with balloon angioplasty during fenestrated and branched EVAR. Positive findings were more frequent for FBVAR than for other procedures, 35% versus 16%. And the study also found that digital subtraction angiography alone would not have detected the positive findings in 79% of the cases. The final paper I'd like to present is a randomized controlled trial of drug-coated balloon angioplasty in venous anastomotic stenosis of a dialysis arteriovenous graft, authored by Dr. Liao and colleagues from Taiwan. In this prospective randomized controlled trial, 44 patients with venous anastomotic stenosis underwent angioplasty either with paclitaxel coated or with conventional balloon. The primary endpoint was target lesion primary patency at 6 months. This was significantly better after drug-coated balloon angioplasty, and the difference was also significant between the two groups in 6-month excess circuit patency. While the 1-year target lesion patency was still significantly better after drug-coated balloon angioplasty, the difference, unfortunately, between excess circuit patency was no longer significant, and there was also no difference in anatomic or clinical success between the groups. So the study concluded that drug-coated balloon angioplasty showed a modest improvement at 6 months, but by 1 year the benefit was not durable and repeat interventions were equally needed in both groups. These were just a few of the many excellent papers we published in the June issue of the JVS. Hope you will enjoy reading them. Please follow us on social media. And remember, in this time of crisis, to protect your patients, protect yourself and your family from the coronavirus. Thank you for watching, and see you next time for the highlights of the July issue of the Journal of Vascular Surgery.